If you're a physio working pitch side and you witness a player become unconscious following a concussion, stop your players from doing this and putting themselves at risk. There's this false assumption that when a player loses consciousness following a concussion, they swallow the tongue. What actually happens is as the player loses consciousness, the body and the muscles relax and the tongue falls backwards and covers the airway. When this happens, you typically see some players trying to rush in and put their fingers down another player's throat to try and pull the tongue forward. When in actual fact, they're putting themselves and their fingers at risk of being bitten and damaged. Especially if a player is convulsing, they will try and close their jaw and run that risk of biting someone's finger. So what needs to happen? The safest way to open a player's airway is to come onto the field of play, come into mills and apply a jaw thrust. These techniques are typically taught on FA, RFL and RFU courses and are easy techniques to apply. In this scenario, you want to avoid applying a head tilt chin lift because you can't rule out a neck injury following a player losing consciousness. So to keep the player safe, keep the neck still, stop them from moving and open up their airway. This means the neck will stay stable, the airway will become patent and the player can breathe. If you want to learn more about concussion management, go to the FA, RFU's or RFL's website to learn more.